Good evening, Columbus community. It is Board President Adair, and I am calling the special board meeting on January 12th to order. Mr. Treasurer, will you please call the roll?
President Adair,
Present.
Ms. Beckerly,
Yes.
Mr. Brown,
I'm here.
Mr. Cole,
I am here.
Dr. Pierce,
Present.
Mr. Ragland,
Here.
Vice President Reyes.
Here.
You have a quorum.
Thank you so much. Board members, you were given the agenda and the materials are also on board docs if you wanted to follow along yourselves. Tonight's agenda, we will have a presentation on winter co-curricular activities during COVID-19 and then have a board discussion about it. And those are the only two items on our discussion agenda, and then we will adjourn. Is there a motion to approve our agenda this evening?
I move.
Second?
Second.
Second.
Thank you. Please call the roll.
President Adair,
Yes.
Ms. Beckerly, Ms. Beckerly, I did not hear you.
I think something's wrong with turn off your ear. Yeah.
Just give us a thumbs up for now.
Yep. That's a yes. Mr. Brown, thank you. Mr. Brown,
Yes.
Mr. Cole,
Yes.
Dr. Pierce,
Yes.
Mr. Ragland,
Yes.
Vice President Reyes.
Yes.
That motion carried.
Thank you so much. I will turn it over to our superintendent, who will lead us through a presentation on item 3.01.
Yes.
Good evening, Madam Superintendent.
Carried.
Good evening, Board President Adair.
Over to
Good evening, Board President Adair. So tonight, the administration would like to do a presentation on our winter extracurricular activities, athletics and co-curricular activities. We know that the public has had some concerns about us continuing under the health advisory and want to know what are our plans and how could we safely return to winter sports and offer extracurricular activities during COVID, and how can we do so safely? So tonight, we will start with a presentation from Edward Johnson from the Columbus Public Health. Following Mr. Johnson, it will be Dr. Betty Hill that will present a safety plan for extracurricular activities, and then followed by Dr. Vincent Clarino, who will present on a safety plan for athletics. We believe that these plans have all the protocols and guidelines that we could bring students back safely by closely following these protocols and guidelines that will be outlined and that was shared with you in your packets that you received over the weekend. So without further ado, our start, we also have Dr. Sarah Bodie, who will be joining us from Nationwide Children's Hospital, who will also be available to answer questions for the board as well. Thank you again for all the questions that were submitted from various stakeholders. We appreciate those questions that were submitted. We will answer those questions for you tonight in part as part of the presentation. So we believe that the plans that will be presented tonight would demonstrate the thoughtfulness that administration, along in part with other stakeholders, teachers, et cetera, will demonstrate two very strong plans that we would like to ask the board for consideration. All right, without further ado, I will move to Edward Johnson from Columbus Public Health.
Good evening. Give me one moment to get my presentation loaded here. So as of today, January 12th, 2021, we're just shy of 100,000 cases in the entirety of Franklin County, with 2/3 of those being in the city of Columbus. We see there a 1% case fatality rate, 525 families that we have to be very thoughtful of that have lost loved ones. But we know that a majority of those fatalities are also coming in long-term care facilities. We're also seeing a 4% hospitalization rate, 2,567 individuals over the course of the pandemic have been hospitalized from the city of Columbus. That percentage has decreased over the course of the pandemic, but that is because the number of cases has risen so quickly. In terms of one breakdown that we like to share is the race and ethnicity data, so that we can understand who's bearing the burden of this disease locally. As you can see here in terms of cases, and this is countywide data, and we can provide Columbus specific data if needed as well. But the most important number that kind of shows us who's bearing the burden of disease is the third number within each box, that bracketed number. And so we see that non-Hispanic whites in terms of cases are 4,488 cases per 100,000 of population. But you see when you move to the non-Hispanic Black, the Hispanic, and the non-Hispanic Asian categories, that the burden of disease is attacking them at much higher rates. You also see that translating across hospitalizations as well when you look at those bracketed numbers in the orange, the dark blue, and the light blue boxes. As I had mentioned, a majority of our fatalities are occurring in long-term care facilities, and so that's why you see that box there in red being so large. But once again, when you look at the rate per 100,000 of population, you'll see that non-Hispanic Blacks are really bearing the heaviest burden of COVID-19 deaths locally. In terms of age breakdown, we continue to see our 20 to 29-year-old age group is really driving infection locally, with some special considerations for that 30 to 39-year-old age group as well. So we know that that's where a lot of that's occurring. I think of particular interest for this group, we look at that 0 to 19-year-old age cohort. And what we do know is that if we break it down into fourths, it's the upper fourth, that kind of 15 to 19-year-old age group, that's driving many of the cases in that group. In terms of geography of cases, you can see here on the blue map, that's just the raw number of cases within each zip code. But the red or orange shaded map is where you start to see that equalized for the number of people that are contained within each zip code. So you can once again see which zip codes are really bearing the heaviest burden, with the darker shades indicating more of a burden. And those are a lot of our central zip codes, with some of the outlying zip codes starting to shade darker as well. Additionally, we do break down some of the information by Celebrate One priority area. So we know that these are areas of opportunity for the entire city, areas where we have much work to do in terms of economic, educational, and financial health. And so we do see there that the cases and the hospitalizations and even the deaths are occurring at a higher rate relative to the rest of the city. In terms of how the pandemic is going, the rate of progress that we're seeing here, we saw 3 peaks prior to the current one that we're on, around late April, May of last year, just after the 4th of July of last year, just after Labor Day of last year. But then you see this current plateau that we're on has really just completely obliterated those 3 previous peaks that we're currently sitting on, with a lot of reporting days. This comes with good news and bad news when you really hone in on kind of these last 5 weeks that we've seen. For 4 of those 5 weeks, we saw a decrease in the number of cases. However, over the last week, we've seen about a 5% increase in the number of cases reported to Columbus Public Health.
Edward, I'm so sorry, and I'm so sorry to interrupt everyone. Apparently, we are having a transmission problem on Facebook, which means we are not live there. So we need to pause and see if we can get that corrected to ensure that our meeting is public and the public is receiving this information. So So I'm not sure, Scott Wortman, if you want to jump in and kind of tell us what the plan is. But I'm so sorry for interrupting you, Edward.
We are up on YouTube.
President Adair, Paul Brown and I are working on the live stream for Facebook. We are on YouTube, yes, but we are not on Facebook at the moment, but we're going to troubleshoot that.
Okay, so how long do you know what happened, or is it an easy fix, or what should we do? What's your recommendation?
I unfortunately don't know the answer to that. If we could just pause for a moment so we can go live on Facebook.
Yes, Madam President. Do you think it would be appropriate to recess for about 10 minutes?
Yes, let's go ahead and do that so we can come off of YouTube as well and then start back up all at the same time. Does that work? So, I'm so sorry, Edward. Can we have
No worries.
we'll take a brief recess for about 10 minutes and then come back live when we can get both streams working.
Thank you, ma'am.